Well, there's obviously a lot of optimism about stem cells in the treatment of brain injury, including ischemic stroke and traumatic brain injury, mainly because of its pluripotential nature. And there have been hundreds of preclinical animal studies showing in general beneficial effects of stem cells, including reduction of infarct volume. But the translation of those preclinical studies to a reliable and consistent therapy that improves outcomes has been more challenging. So there have been a handful of randomized trials, none of which have really panned out, even for ischemic stroke. There's been a little more research done in ischemic heart disease. There have been dozens of randomized trials, some of which have shown a benefit in terms of heart function. But even in those two conditions, ischemic heart disease and ischemic stroke, there have not been any large randomized double-blind controlled trials that have shown a consistent benefit. For concussions, there have been essentially no trials, clinical trials for this. And while there's reason to believe that stem cell therapy may be beneficial, I think it's way too early to jump to the conclusion that it is beneficial for patients. Most of the research has focused on traumatic brain injury, again, in terms of animal models and clinical trials. There are a whole range of studies, mainly clinical studies, looking at how to diagnose concussions and how to translate some of what we know about traumatic brain injury, more serious traumatic brain injury, into more minor brain injuries like concussions. But as to date, there's not a foolproof, simple treatment for concussion other than rest, which is what we advise our patients. As a physician scientist, we're always open to new ideas and to looking at different ways of using innovative therapies. Having said that, we need to be very cautious about claims and promises to patients who may be under the assumption or the belief that this therapy has been shown to be effective, and it hasn't. So as long as studies are being done in a carefully controlled way under a institutional review board, IRB, ethically approved way, then I think this type of stem cell research is fine and appropriate. What we just need to be careful about is the application of these non-proven therapies to patients under the guise of a proven therapy, which it is not yet. I think that we're all open to new ideas and innovative therapies, but we're not quite there yet in terms of the science to advocate stem cell therapy really for anything yet. Again, we're probably closest for ischemic heart disease. For ischemic stroke, we're not quite there yet. For traumatic brain injury, we're not there yet. And for concussions, all bets are off. We haven't even begun to study this, really.